Hi friends, I'm Sutar sir. I'm going to give you a lecture on AIDS. Friends, you know that what is AIDS? What are the positive agents of the AIDS are there? How this AIDS is there is occurs? Then how you are going to identify the patient is there which will suffer by AIDS? Likewise, the different things are there that we are going to study in this one lectures. Friends, AIDS. In this chapter, we are going to study the pathophysiology of the drug therapy of the HIV, that is the human immunodeficiency virus is there, then AIDS, acquired immunodeficiency syndrome, and opportunistic infections are there. In this chapter, we are to be repeatedly heard the two words that is the HIV and AIDS. These are the two words are there that are to be correlated with each other. One is a virus, that is a human immunodeficiency virus is there, or we can say that human immunovirus is there. And second one is there because of which, what is the deficiency which is to be occurs in our body, and that is to be occur, that is not to be found naturally. So acquired immunodeficiency syndrome, because of the HIV virus, we lost our immunity power, and because of which, what are the symptoms are there that is occur because of the deficiency of our natural immunity. The condition is there is known as AIDS is there. Now how can you say that, or how you are going to identify this one patient is there suffer by the AIDS? Means it is nothing but it is a simple thing is there. When you're the normal person, if two persons are there that are to be taken, and if the same one infection is there to be found in both the patients, that is for example diarrhea, if you are going to take consideration, if normal person is getting the cure by diarrhea by using a normal treatment, but if the patient is there is having AIDS, then that patient is unable to control on this one diarrhea on the same treatment which is given to the healthy person. So in that case, we can consider the patient is suffer by AIDS if there. Likewise, the conditions are there. Yeah, you know that what is the symbol? This is a symbol of the AIDS are there. In this one symbol, we are going to identify the patients are there that are to be suffer by AIDS is there. In this one symbol, so for that, our government is there is decided to uh, have a day in our calendar, that is AIDS day is there. You know that what is that AIDS day, on which date that day is there we are going to consider, that is nothing but your 1st December of each year. On this date, what are the other peoples or healthy peoples are there that are going to provide support or help to this one deceased persons are there in different type of the ways are there. So they doesn't feel any guilty regarding this one suffering of this one disease, that is AIDS is there. Now, the next one is there. What is HIV? HIV is nothing but a virus is there. That is a human immunodeficiency virus is there. One any one person that is to be infected by HIV, that person is there is to be considered as a HIV positive person. However, any one person is there that is suffer, but it is not like that. If the person is HIV infected, then there is a sickness, illness, or the sign and symptoms are there that is be appears, or he or she feel weakness or sick. Likewise, it is not like that. If initially the HIV virus is there is infected to the person, the sign and symptoms are there that are not to be appear, and that person is behaves or self uh, shows the responsibility just like a normal person. He doesn't have any type of the sickness or illness are there. He look like healthy for a long time after being infected. Now, what is AIDS? AIDS is nothing but is because of the human immunodeficiency virus which goes into our body, it decreases your efficiency or immunity power. So because of which the different type of the diseases are there that are to be attack on our body. In response to that, our immunity power is there is not able to fight against this one, and the person is may die at the last stage. This is your acquired immunodeficiency syndrome. AIDS is nothing but is your acquired immunodeficiency syndrome, can take many years to develop this one disease once the virus is enters into your body. Eventually, the virus kills or impairs one or more cell of your immunity system. Is when that virus is enter, we can say that HIV virus is enters into your body. It tries to kill the different type of the normal healthy cells from your immunity system, and in response to that, you're going to make a copy of the HIV virus infected cell, and that are to be spread widely in your body, and because of which your body loses ability to fight against a single or common infection, such as the diarrhea is there, cold is there, like what the infections are there. People with AIDS die from the disease, usually not which are not a dangerous one. This simple common diseases are there, such as your fever is there, malaria is there, then cold is there, then your diarrhea is there, dysentery is there. In that attack of this one disease, also the patient may get die because their immunity power is there is not strong or able to fight against this one disease causing pathogens are there. So the patient may get die, not because of the age, but because of the decreased immunity power is there. From this one, you came to know that which type of the drugs are there that are the works. Yes, the agent or the drugs which improves the immunity power. That if you have to give such type of the agents to the infected or AIDS patient, then their immunity power may increase and they fight against this one particular disease also. Now, epidemiology of whether this disease is there should occurs at a particular age. No, the disease if there is not found in a particular age, but any age that disease is there should be occur because the causative agents are there, which should be or transfer of the disease is there is to be occur because of the such thing, so that any type of the patient comes in this one disease. No, any other country there is a special for that in that country only that such type of the disease is there should occur. All over the world, that disease is there is to be spread and it causes infection to the patients. In some cities, as many as 50% males are HIV positive ones. AIDS is now a second leading cause of the death is there because most of the people are suffered by this one AIDS, and the age group is there is about 25 to 44 years is there, and in this age the people may get infected because of this on AIDS, or we can say that HIV infected or HIV positive, and the death may occurs. Now, what are the symptoms of this one are there? There are basically five type of the symptoms are there that should be observed, such as your pulmonary infection. Most of the time, the pulmonary infections are there that should be found in such type of the patients, such as the pneumonia is the one is there, or the likewise the infections are there which should be observed. Then GIT infections are there, that is the gastrointestinal infections are there. Then neurological or psychiatric involvements are there, then tumor or the malignancy is there, then other opportunistic infections are there, means attack of the different type of the infections which are common one. These five type of the symptoms are there which is observed in such type of the patient. Early infection, if you have to consider a HIV infected patient, then what are their early infections are there more common to develop a flu-like illness for 2 to 4 weeks. If the patient is actually infected by HIV or is having AIDS, in that patient, 2 to 4 weeks there is a flu-like symptoms are there that is we found becoming the infected, and the signs and symptoms may include fever, fever is there, headache is there, then sore throat is there, then swollen lymph glands are there, then the rash are there that are to be observed in such type of the patients. These are the main symptoms are there, such as the neurological symptoms are there, that is the encephalitis is the one, and meningitis is the one, that is a headache or front head, there is a pains are there that you observe on the forehead, that is a neurological symptoms are there, retinitis is there, that is a disease related to your retina in the eye is there, then lungs are there. Mostly in case of the lung, there is a pneumonia like symptoms are there that shows, then tuberculosis is there, that is a tuberculosis of the multiple organs are there that is we observe, then tumors are there, then skin tumors are there on the skin, some of the tumors are there that is we observe, then gastrointestinal are there, that is such as your esophagitis one is there, then chronic diarrhea is there, then tumors are there like the different signs and symptoms are there which we observe in case of this one. If we consider the pathophysiology of the AIDS is there, how this AIDS is occurs. In such type of the case is there, that is a uh, HIV, and the treatments are there that should be available, but that treatment is there is not to cure the HIV or AIDS. But what is sign and symptoms are there to control on this one sign and symptom. Just initially I told you that if you have to provide the immunomodulatory drugs, so their immunity power is there should be increased to fight against the different type of the infection, but they such type of the agents are there that are not able to kill the HIV virus. So how this HIV virus is their issue occurs in that we are going to see by this one figure. HIV, once the HIV virus is there issue enters into your body, it tries to infect CD4 cell. Now what is that CD4 cell? CD4 cell is nothing but a type of the WBC there, that is a microscopic policemen are there, that this one HIV virus tries to infect this one, attack on this one WBC, and like other cells are there. The HIV turns the CD4 cell, that is a type of the WBC cell, uh, into a factory of producing 1,000 of the copy of HIV cell. Means in this case, when this one virus is there, should be attacks on your body. Initially, that attacks on the CD4 cell. That CD4 cell is nothing but is a WBC is there. So after attacking on this one CD4 cell, it convert or asks CD4 cell just like to make the multiple copies, 1,000 copies of the HIV cells are there that is found, and just like this CD4 cell is there, she working as a factory of producing the HIV virus cells are there. Now, in this case, there are the 4 to 5 stages are there which is be involved, such as the first one is there, that is a binding, and the fusion is there. Means let's see what are the different phases are there, and in detail we are going to see one by one. First one is there, that is a binding, and the fusion is there which is be found in this one. Second one is there, a reverse transcription phase is there, that is a reverse transcription phase. Third one is there, that is the integration phase is there. Then next one is the transcription phase. Then fifth one is there, that is a assembly, and sixth one is there, that is a budding. Likewise, the different type of the phases are there we have to be observed in case of this one. Now let's see one by one. What is the first one phase, that is a binding, and the fusion is there. HIV virus can't cure, means HIV virus is there is not get to be cured or get killed from the body. But what is the treatment which are going to use for this one, that only help to control on this one particular infection are there, or that are going to increase the immunity power is there. Likewise, the things are there that we have to be observed in case of this one. Is there once the HIV is get infected uh, to the CD4 cell, a type of the white blood cells are there and other cells are there. This one HIV turns the HIV virus turns the CD4 cell into the factory of producing 1,000 of the copies of the HIV virus is there. You have to be see here one by one. We're going to see first one page is there, just like one is there, that is the and that is the binding and the fusions are there, then reverse transcription are there, integration phase is there, transcription is there, then assembly and budding phase are there. Likewise, the 4 to 6 pages are there in case of this one. Let's see one by one. Binding phase is there when HIV begins to enter a CD4 cell by binding or attaching itself to a specific point. Means whenever this one virus is there, it enters into our body. Firstly, that virus is tries to bind with the CD4 cell at a specific receptor. Means on this one CD4 cell, the receptors are there that are to be present. Because this is just like a lock and key model is there. So for this one virus, the receptors are there that is required on the CD4 cell, and when this one virus is bind to the CD4 cell receptor on the cell surface, that issue goes infected. HIV then must bind to a receptor, either the CCR5 co-receptor or the CXCR4 co-receptor. These two receptors are there such as your CCR5 or CXCR4. These are the co-receptors are there which are responsible to bind with this one virus. So that after this one binding, this one virus, this allows the virus, mean this receptor allows the virus to join or to merge with the CD4 cell. What is the microscopic or the WBC cell is there which should be help for to fight with this one another pathogenic microorganism, but because of which this receptor, this allow this virus if there should be enters into the CD4 cell by a process. That process is there is known as a fusion process. After the fusion, HIV release its RNA. Means when the virus if there should be enters into the cell, this virus or HIV virus that releases RNA. We can say that the genetic material of the virus is there or HIV genetic material, and along with that enzymes are there. This enzyme that is responsible for the certain chemical reaction into the CD4 cell. This is the binding and the fusion step is there. Now the next one is there, that is a reverse transcription phase is there. In case of this one HIV virus, HIV RNA which is being multiply when there is a attack if there is occurs by this one on the CD4 cell, when this release that RNA is there, when this one HIV RNA it contains the instruction that will program the CD4 cell to produce more virus. The CD4 cell is generally when it is not to be affected, these are going to produce the special type of the proteins are there which are responsible to fight against the different type of the viruses are there. But when this one CD4 cell is get infected, the brain of this one cell is get totally controlled under the direction of the HIV RNA virus, so that they are going to produce the multiple number of the viruses. In order to be effective, HIV RNA must be changed into the DNA. When the multiplication is there should be carried out, in that multiplication this RNA HIV RNA is changed into the DNA, and HIV enzyme which is to be responsible for this reaction, that is a reverse transcriptase enzyme is there that change HIV RNA into the HIV DNA. Means because of this one transcriptase reverse transcriptase enzyme, this HIV RNA is there that should be converted into the HIV DNA, and because of which you know that what is the importance of DNA. The same type of the cells are there that are to be produced, that is the infected cells are there that are produced in our body. Now the next one is there, that is the integration phase is there. In this one, integration next to the newly formed HIV DNA that enters the nucleus, that is a command center of the CD4 cell. Means where the CD4 cells are there that are to be produced this one DNA, and that integration is there is to be carried out of this one same type of the infected cells are there that is to be carried out. Another HIV enzyme that is known as a invertase enzyme that combines or integrate HIV DNA and the other CD4 cells DNA, and because of which the multiplication as well as the integration is there is to be combined and occurs. In case of the integration, invertase enzyme such as the integrate enzyme is there that plays an important role that causes the combination or mixing of the HIV DNA with the other CD4 cells DNA is there should be carried out, because this is the phase is there, that is the integration phase is there. Now the next one is there, that is a transcription phase is there. Once this one virus is integrated into the CD4 cell, it commands the CD4 cell to start making a new HIV protein. Means all these things are there that is we found as per this one CD4 cell or HIV infected CD4 cell. They start to make a new HIV proteins are there that is we carried out. Now the proteins that are building block for the new HIV virus. Proteins are the building block elements are there, but what are the infected cells are there that produces such type of the proteins, and these proteins are there that are for the new HIV virus are there. They are produce a long chain. Now the next one phase is there, that is a assembly is there. An enzyme called protease. That protease enzyme cuts the long chain of HIV proteins into the smaller fragment or into the smaller pieces. As the smaller proteins or pieces of the smaller proteins combines together with the copies of HIV RNA, a new virus is put together and assembled. Means new cells are there or HIV virus cell proteins are there, then the chain is there should be breaks and that is should be combined with this HIV RNA, and then a new type of the material is there, that is the infected HIV virus is there, it should be prepared. Budding a newly assembled virus are that pushes out the original CD4 cell. So that original the CD4 cells are there, that is to be replaced by this one infected virus cell, or we can say that infected HIV virus cell. This new virus can now target the infect the other CD4 cell. Likewise, the slowly all over the body, the healthy, fresh, uninfected cells are there that should be replaced by old HIV infected cells. Now, the different classes or the groups of the HIV drugs that blocks the different steps in the HIV cycles. In case of this one, the different type of the cells are there that we have to observe. US Food and the Drug Administration has approved six classes of the drug, that is the entry inhibitors are there. Means what are the treatments are there which should be used in the treatment of the HIV or AIDS. It shows the six parameters by which the different mechanisms are there, the drugs plays an important role. First one thing is there, that is the entry inhibitor. Initially the entrance of this one HIV virus is there should be inhibited. Second one, integrase inhibitors, means where the integration of this one HIV virus is there should be carried out, that level the drug plays at its important role. Then nucleoside and nucleotide reverse transcriptase inhibitors are there, such as your NRTIS or the nucase are the one is there. Then non-nucleotide reverse transcriptase inhibitors are there. Then protease inhibitors are there. Then boosting agents are there, such as your immune power boosters are there that are given. Likewise, the different type of the mechanisms are there by which AIDS plays an important role. By which mechanism? Entry inhibitor, integrate inhibitor, then nucleotide and nucleoid reverse transcriptase inhibitors, then non-nucleotide reverse transcriptase inhibitor, protease inhibitors, then boosting agents are there. Now, entry inhibitor, this what is the role of this one entry inhibitor? They stop the HIV from entering the CD4 cell. This type of the agents are there that blocks the HIV virus to enter into the CD4 cell. The different type of the entry inhibitors are there, such as the fusion inhibitors are there. Means they play their role at the time of the fusions of the CD4 cell with the HIV infected cells. Then CCR5 antagonist, means what is the receptor which is responsible to give or give permit to enter this one virus at that level also. This drug plays an important role. This blocks this one receptor to bind with this one HIV infected virus, such as maraviric is there, that is plays an important role. Then post attachment inhibitors are there, that is a toragazo Trogarzo is the one is there which plays an important role. Then integrate inhibitors are there, interfere with the HIV integrase enzyme. What is the enzyme which is responsible for conversion of HIV RNA into the HIV DNA? And that this drug plays an important role. We avoid the conversion of HIV RNA into the HIV DNA. There are four integrase inhibitors of the HIV treatments are there, such as your Trace is there, then Tivigasi is there, then Victa is the one is there, then Bactavir is the one, then combination pills are there, that is of Bicavitvi is the one. Likewise, the different type of the agents plays an important role in this one. Now, most of the HIV is transmission. How this HIV is there should transfer. First one, the most important is there, that is the 50% chances are there, that is by the sexual contact. Second one is there by the parental transmission. There are about 100% chances of this one transfer of disease is there is to be because of the parental transmission. Is there if sometime the blood of that one infected patient is to be given, or the infected donor is transmitted to the another one healthy person in emergency case, then such type of the agents or may get entered. Then vertical transmission, that is from mother to the fetus is there. Then homosexuals are there. Then heterosexuals are there, means for sex between the same are there, in which same genetics is there, then that is also responsible to cause this one transfer of this one is there. Then IVDA there, that is a hemophilics. Then accidental needle sticks are there that may get infected. Now, this is mostly found in the film theaters are there, where the any one person is there that should be infected by HIV. He picks his blood by using needle and goes to inject to the someone's so that that person is also get infected. Likewise, the practices are there that should be occur, but that is a very bad practice is there. From mother to the child during the delivery is there. That is also one of the thing is there by which this is the mode of the transmission is there is to be found. These are the sexual intercourse. The chances is there about 0.1 to 1%. However, the frequency is high, causing the highest rate of the infection is there. Then by using injection, there about 0.5 to 1% chances are there. Then parent to the child, there are about 30%. And blood or the blood product issues or organs are there more than 90% chances are there by which the disease is there is transferred mother to the baby, that is before the birth. If the lady is get infected by HIV virus or AIDS is there, so that the becoming what is the fetus is there, he may or she may get infected by this one during the birth also. The disease is there should be transferred. Then postpartum is there. Likewise, the disease transfers are there that to be occurs. Effect of AIDS on the pregnancy is there. Because if the lady is there is having AIDS before the pregnancy, in that case infertility is there issue be occur, means the lady is unable to become pregnant one. That is the infertility condition is there. Repeated abortions are there, means though the lady become pregnant one, but that is not a complete one is there. Meanwhile, there's a chances of the abortions are there that are to be found. Then prematurity is the one is the another condition is there because of the AIDS is there issue occur. Then intrauterine growth retardation is there. Uterus growth if there is not to be found in the such type of the ladies or to be suffered by the HIV infected virus is there. Then stillbirths are there, means there is no growth of the fetus if there should be found. Then congenital abnormalities are there, means what is the become fetus is there that is become abnormal because of the HIV infected virus is there. Then embryopathies is the one condition is there, that embryo is there is not to be found or developed in such type of the ladies. These are the common signs and symptoms of the ladies are there. We are going to be infected by the HIV. There are the four stages are there by which HIV is there should occur. That is the primary. Uh, First phase is the primary one. Second phase is the that is asymptomatic. Third one is there that is symptomatic. And fourth one is there that is the HIV or AIDS. HIV to AIDS is the one. How many stages are there? Depends on the stage. The treatments by the physicians are there that are to be given. The first one stage is there, that is a primary phase is there. Means once the lady or the human is get infected by HIV, in that patient a flu-like illness or the symptoms are there that she appears. Occur 1 to 6 weeks after the infection. Means once the infection is there, she occur the flu-like symptoms are there or illness is there, she observe in such type of the patients is there. Then no any other symptoms are there that is observed in such type of the patients are there. Then infected person can infect other people, so other people may get infected by such type of the persons. Then second stage is there is a asymptomatic stage where the symptoms are there that is not to be developed. The last for an average of the 10 years, the symptoms are there that is not to be developed in such type of the patient. After the 10 years, the symptoms are there that are to be tried to develop. In this stage, it is to be free from the symptom. There may be a swollen gland. Some of the glands are there that show swelling, or we can say that the swollen glands are there. The level of the HIV in the blood drops to a very low level. If there means the HIV infections are there that is very low. If there should be found HIV antibodies are detected in the blood. As anyone foreign particles are there that is enters into our body, our in response to that, our body is trying to kill that agent. In response to that, our body is going to prepare some of the chemical that is known as antibodies. So that if this one HIV virus is enters into our body, that is a foreign particle. So in response to that, our body is prepared some of the chemical which is known as antibody, and these antibodies are fight against the HIV. So that such type of the antibodies are there that are to be detected in the blood. Means why these antibodies are formed? Because the HIV is enters into your blood, so that the HIV antibodies are produced in that one patient's body. So if that bodies are there that are to be detected, the patient may suffer by this one HIV infections. Third one is there that is symptomatic is there. The symptoms are mild one here, and the immune system is there deteriorates. I mean, your immune system in there is not proper one to fight against such type of the infections are there. Then in emergency, opportunistic infections are there that is found. Means one by one or the chain of the infection or the sequence of the infections are there that is found in the such type of the patients are there. Once he suffer by the diarrhea, on the treatment he is going to suffer by the cold, fever, and malaria, dengue. Likewise, the infections are there that she found in such type of the patients are there. That is the because the patient's immune power is there is goes on decreasing, and because of which is or she may suffer by these one diseases. And lastly, the cancers. Stage 4, that is the HIV or AIDS is there. The immune system weakens. Means this is the last stage there. Your immune system is there is not able to fight, and because of it, the illness become more severe, leading to an AIDS diagnosis. Means the patient may have AIDS, and last this condition is there is found. Now the treatment for this one is there is this type of the treatment is there has not been easy, or successful treatments are there for the HIV or the AIDS are there that are only used to control the other infection but not HIV or AIDS. Bone marrow transplantation is there, then immunomodulators are there, or the transfusions are there that are to be helpful in this one particular treatment, but the success is there is questionable. But definitely, if the bone marrow treatments are there that are to be given, and such about the treatment is there is helpful. But these are not easy one, and these are not uh, too much cheap. These are the so costly one. Prevents viral replication. The reverse transcription inhibitors are there. The inhibitors in this one treatment AZT is the one drug is there that should be given, that is a azidothymidine. It's also called as jurovardin. This is the drug is there that should be given. The drug is there should be used to delay the development of the AIDS. Means the multiplication, what is the rate of the multiplication is there that delays the rate in the replications of this one AIDS cells are there. That is acquired immunodeficiency syndrome in the patient infected with the HIV. Then protease inhibitors are there, where these block the proteins conversion of these sort of proteins are there. That is a as a atazanavir is the one, and indinavir is the second one drug is there which is used in the protease inhibitors are there. Then integrase inhibitors are there. Integration is there which we carry out at that one, that is a Gravir is the one, whereas second one is there, Raltigravir is the second one drug is the choice is there for this one. Then maturation inhibitors are there, that is a Baviramat. Baviramat is the one drug is there which is used in such of the treatment. Then fusion inhibitors is there, that is a and viridity is the one is there. Then penetration and uncoating inhibitors are there. That is a amantadine is there. Then mRNA synthesis inhibitors are there. That is a ribavirin is the one. Then immunomodulators are there. That is a interferons and others such as your acyclovir is the one. Then valaciclovir. Then Zuridine is the likewise the drugs are there that are to be given for this one treatments are there. Then antiviral drugs are there which are to be shows just like this one is there, that is a nucleoside or nucleotides are there. Then non-nucleosides, then reverse transcriptase inhibitors are then protease inhibitors are there, then fusion inhibitors are there. Likewise the different type of the drugs and their names are there that are to be given. The molecule which are shows their action by this one mechanism. These are the antiviral drug therapy is there. This is the various pages are there by which we are going to give the treatment. Either the drug shows first one entry to the inhibitors. It avoid the drug avoid the entry of such type of the viruses. Second one maturation inhibitors are there, and this one the drug is there is not allowed to mature this one viruses. Then protease inhibitors for the protein which is very required for this one synthesis that is not be uh, helpful in case of this one is there. Then integrase inhibitors are there, integrations are there that is we block by this one. Then reverse transcriptase protease inhibitor where the RNA is converted into the DNA that is we stop here. By this way the drug shows their mechanisms and different type of the as per the development of the age the drug treatments are there that are to be prescribed by physicians. Then HAART, that is a high effective antiretroviral therapy is the one. This is HAART therapy is there, in which antiretroviral therapy is recommended if the patient is asymptomatic and the patient does not show any type of the symptoms are there where the CD4 cell is count is less than 350 microliter. Any age-defining condition, the plasma HIV RNA is greater. If the sample is to be taken, and in this one, the HIV virus, if there is more than 1 lakh copies per ml, then in that case, such other treatments are there that are to be given. HART combines the two type of the antiretroviral drugs are there in a triple cocktail. In cocktail means a mixing of the three different type of the drugs are there that are to be carried out such as NRTIS. NRTI is nothing but your nucleotide reverse transcriptase inhibitors are there and protease inhibitors are there. The second one is there two NRTIS and one NRTI1. Such one therapy there is also given uh, for this one is there. Second one, reverse transcriptase inhibitors are there. In this case, the 2,3 deoxynucleosides are there that are to be given. All com- competitively inhibit the DNA dependent RNA. In those RNA which are to be dependent on the DNA, in this case, that are inhibited polymerase, that is the reverse transcriptase, all block the early event in the virus. Means there is no replication of the virus if there is found in such a case. Then resistance develop due to the change in the enzyme. The high virus load result in the mutants that are resistance. And the cross resistance is not a complete, so can switch from one inhibitor to the another or use in a combination of the decreased resistance but do not use two drugs together with the same adverse effect. Such type of the treatment is there should be given the high level of the RT, that is river transcriptase is their mutation and the resistance to the nucleoside inhibitors lead to the development of the non-nucleoside inhibitors are there. The drugs are non-competitive inhibitors are or the reverse transcriptase are there. The idea is that the mutation in the reverse transcriptase leading to the resistance to the nucleotide inhibitors would be the different than those leading to the resistance to the non-nucleotide inhibitors. Thus, the nucleotide and non-nucleotide reverse transcriptase inhibitors could be used in the combination therapy. In this case, where we see that this is your DNA and this is to be RNA is there, and this is your pockets are there, and this is the NNRTI is the one therapy there. Whenever this one reverse transcriptase is the one, whenever it is we bind with this one, and then there is a chain is there is be complete, or the circle is there should be completed one. The drug sensitive virus is there, that is to be NNRTI is there should bind, so that this one chain is there, and that is the polymerization is there is not to be completed. If the red circle is there, it should be completed. Then the polymerization chain is there, that should be completed. But because of that one green, that is a NNRTI blocking agent, this one chain is there is not to be completed, so that multiplication or the replication of the virus is there is not occur. Then drug resistance virus is there, means an NNRTI binding is there is we block sometime, so that the normal DNA polymerization is there is to be carried out. In case of this one is there is to be carried out, means in case of the normal cell, this one NNRTI is there is not to be effective, and there is a normal polymerization is there is to be carried out. In case of the drug resistance virus is there, if the virus is there is having a resistance to the drug, then such type of the treatment is not effective. Pseudoverdin, such as your azidothymidine, AZT, then deoxythymidine, analog is there, then anti-HIV1 and HIV2 are there, that is well absorbed from the gut and disturb to most body tissues and fluid, including the cerebrospinal fluid. This is the most important drawback of this one drug, that is eliminated primarily by the renal excretion following the glucuronidation in the liver is that should be carried out, and decrease the rate of the clinical disease progression and prolong the survival. Because of this one particular treatment, it decreases the clinical disease progress, means progress of this one disease if there is not to be found, and it prolongs the survival of the patients. The treatment HIV is associated with dementia and thrombocytopenia. It reduces the rate of the vertical, that is mother to the newborn, and the transmission of the HIV. Adverse effect, that is a myelosuppression is there, or we can say that anemia or the neutropenia, gastrointestinal intolerance, headache, insomnia, like other conditions are there that are to be found. A non-nucleoside reverse transcriptase inhibitors are there, that is the nevarapine is there, or verapamune is there, then delta viridin or sectors are there, like other treatments are there that are given. NNRTI are generally hydrophobic molecules that are bind to allosteric binding site. Binding to this one allosteric site blocks the neighboring substrate binding site into the inactive conformation, means what is the virus is there is not able to bind with this one. However, the resistance to this one NNRTI can develop rapidly, and thus they are used in combination with NRTIS. Means in NNRTI, the very well chances are there to develop a resistance, so that the combination therapy there is used. Then protease inhibitors are there, including the rotonavir is there, then nelfinavir is there, then sequinavir is there, indiviavir is there, like when the treatments are there that are given. GRAC or the GAC pol genes are there that translate the uh, polyproteins immature budding particles to the in the presence of the protease enzyme. The conversion of the final structure of the protein, mal urinocones are there that is found. This is the fusion or the entry inhibitors are there, where these drugs are there that is not able to allow the fusion. There are the several key proteins that are to be involved in the HIV process are there, such as the CD4, a protein receptor found in the surface of the helper T cell in the Human immune system is called CD4 T cells are there. GP120, a protein on the HIV surface that binds to the CD4 receptor. CCR5, a second receptor found in the surface of the CD4 cells, is called as a chemokinase uh, co-receptors are there. Then CXCR5 4 is the another chemokinase receptor found in the CD4 cells. GP41, a HIV protein closely associated with the GP120 that penetrates the cell membrane. Ribavirin is the one drug of the choice is there that act against many DNA and RNA virus, HIV DNA and RNA virus, and highly active against the influenza A and influenza B, but is only approved for treating the RSV in infants and young children by aerosol and hepatitis C together with the interferon. Clinically, ribavirin was shown delay the onset of the full-blown AIDS in patients. Now, how this it shows its mechanism of action. Ribavirin is a genuine analog that is phosphorylated by adenosine kinase or its most active form, uh, ribavirin triphosphate. This compound it inhibits the viral RNA polymerase preferentially at the therapeutic dose and completing the adenosine triphosphate that is a ADP and guanine triphosphate for binding site the polymerase as well as inhibiting the transferase necessary for the addition of the glycine. Then opportunity the various type of the infections are there that is found in case of this one is there that is a myobacterium tuberculosis is there then myobacterium avium intracellular is there then protomegalos virus are there which are to be found then CMV retinitis are there then penicillium marfans are there which are to be found the attack of this one various type of the infections are there which are to be found in the AIDS patients are there. These are the different organs are there where this one op, opportunistic infections are there that is found such as the brain, then eyes are there, then mouth, throats are there, lungs are there, stomach is there, liver is there, then reproductive organs are there where this one infections are there that are to be found. Then pneumocystis crani is the one in there where this one pneumonia-like conditions are there that should develop in case of the AIDS or HIV patients is there. Then toxoplasma gondii is the condition is there where trimethoprim sulfamethoxazole one double stain tablet is there orally 2 times a day is there should be given to have a control on this one. Mycobacterium infection that is a mycobacterium tuberculosis azithromycin 1200 milligram orally once weekly. The drug of the choice is that should be given. Then clarithromycin 500 milligram twice daily. Such type the drug are there that are to be given to the patient. Then cryptococcus neoformasis is there is the one is there that is a where in this one treatment that is a fluconazole 100 to 200 milligram orally and the drug of the choice is there is to be given. Then herpes virus is there uh, acyclovir 200 milligram 5 times a day is treatment is there is to be given that is a herpes simplex virus is the one. Then varicella zoster virus is there where the acyclovir 30 milligram per kg per day for at least 7 days acyclovir 4 milligram the orally the drug of the choice is there that should be given. Then cytomegalory drugs are there where the brains eyes lungs and stomachs are there that is we get infected. Thank you. In this way, we are going to complete your topic, that is AIDS is there.